Good morning and welcome. My name is Juliana Keaton, and I serve as Vice President of Corporate Insurance and Associate General Counsel at ViStar Credit Union. Thank you so much for joining us today at WJCT and supporting our caregiving series. We are grateful for your time and engagement as we explore this important topic and the resources available to individuals and families navigating caregiving, responsibilities, and challenges. We hope you find this program informative, meaningful, and empowering, and encourage you to register for our upcoming Caregiving Lunch and Learn events. Our next program, Caring for Your Future Financially, will be held on Thursday, September 10th. But before we begin, please join me in recognizing and thanking our sponsors, whose generous support made this event possible. I'm especially proud to recognize the title sponsor and my employer, ViStar Credit Union. This is just one of the many ways ViStar strives to support and give back to the communities we serve. I'd also like to recognize ElderSource, Pine Castle, Olivia Care, Underhill Staffing, Riverside Post-Acute, and Cornerstone Caregiving, and of course, Brooks Rehabilitation, which not only supports this important effort, but whose wonderful team members are here with us today to share their expertise. Now I'd like to introduce our guest speakers, Genevieve Olagwebel, Teresa Isaac, and Chandler Rice. Genevieve is a registered nurse and holds a Bachelor of Science in Nursing. She is the Director of Nursing at Brooks Rehabilitation Bartram Crossing Skilled Nursing Facility and a proud recipient of the Daisy Award, one of the most prestigious recognition programs in nursing, which honors extraordinary nurses who demonstrate exceptional clinical skill, compassion, and patient-centered care. With over 30 years of nursing and healthcare leadership experience, Genevieve is committed to delivering compassionate care. She is passionate about mentoring the next generation of nurses and certified nursing assistants, fostering a culture of continuous learning and developing future healthcare leaders. Outside of work, Genevieve enjoys spending time with her son and daughter, who is also a registered nurse, and relaxing with her husband, who's sitting over there, while watching their favorite television shows and movies. Teresa Isaac is a clinical nurse educator for aging services at Brooks Rehabilitation, supporting staff development and excellence in care across the Bartram Crossing and University Crossing facilities. A registered nurse with a Bachelor of Science in Nursing, Teresa brings more than 30 years of diverse nursing experience spanning a wide range of clinical settings. And I just learned that she was also nominated for the Daisy Award, so we have two very experienced and exceptional specialists here. Throughout her career, Teresa has been passionate about advancing professional development through innovative training programs that promote the long-term learning, clinical excellence, and regulatory compliance necessary in her field. She is especially dedicated to empowering frontline caregivers with the knowledge, skills, and confidence they need to deliver exceptional care and improve patient outcomes. Outside of work, Teresa enjoys spending time with her husband, her son, and their family pet, Jasper, who keeps life entertaining and full of joy. Finally, Chandler Rice holds a Master of Science degree and is a licensed, registered occupational therapist. She has been with Brooks Home Health for the past 7 years, providing services to diverse patient populations throughout Jacksonville. She works closely with patients and families, navigating recovery from illness, injury, and other health challenges. Chandler has been a past Brooks Star winner and recognized by Brooks as a leader in her division for compassionately helping older adults maintain their independence, daily living skills, and overall quality of life. Please join me in giving a warm welcome to Genevieve, Teresa, and Chandler.
Thank you so much. We're so happy to have y'all with us this morning and talk about how to keep yourselves and your families safe at home, preventing falls and keeping them as independent as possible as well. So first we're going to talk about some common causes of falls in the home. So first we have, of course, different diseases put us older adults at greater risk of falling, right? So stroke is a good example. The reason is after stroke, one side of our body can become weaker than the other, which can affect safety with walking, even getting up from a chair. So it changes the way that someone walks and also how they use their assistive device. Another is dementia. So as we have change in memory, we, have decreased safety awareness, right? Someone might not have the inhibition that they had before to realize that they're doing something more dangerous than before they had the memory change. So we're going to talk about dementia as well. And then the third, one of the other most common would be Parkinson's disease. So our gait or the way that we walk changes with Parkinson's disease. It can create kind of that shuffling gait where someone has a harder time picking up their feet walking, and also affect balance. So there are certainly many other diseases that put people at greater risk for falling, such as diabetes. If we end up having peripheral neuropathy, harder to figure out where your feet are in space, which can lead to tripping more often and again affecting balance. So these are just 3-4 examples, but plenty of diseases, of course, increase risk of falling in older adults. Next area, home dangers. So of course, our environment at home tremendously can increase our chance of falling. Loose carpets, poor lighting throughout the whole house, not just the bedroom and the bathroom, but really any room. And cluttered pathways, so not having enough room for an assistive device, or just the person in general walking through narrow pathways, as well as wet floors. So that would include the bathroom and the kitchen, which we'll talk about some assistive devices in a little bit to help with that. An area that people don't think about as often is medications. So health experts actually flag these types of medications as increasing fall risk in older adults. So even just being on these medications puts us at greater risk. Now, of course, we need to follow our physician's orders, right? A lot of these medications are necessary for health. But it's important if you notice some side effects that are becoming significant. So we put some medication drug names, the common names that you all would recognize, to give some better examples. But dizziness certainly can be a common side effect of a lot of these medications. Some of those benzos like Xanax and Ativan, opioids, so any of our narcotics, they increase sleepiness, drowsiness. Dizziness can be a side effect as well, impacting balance and leading to falls. One that's we don't really often think about as often is over-the-counter allergy medication. Even taking that can cause dizziness, increase, fatigue, which can lead to greater chance of falling. Muscle relaxers, those are kind of self-explanatory, right? If we're taking that, we're relaxing our nervous system, which can impact the strength in our legs while we're on the medication. And certainly medications affecting blood pressure. So the goal with lisinopril, carvedilol, metoprolol is to decrease high blood pressure or a high heart rate. But on the flip side of that, if the dose needs to be adjusted, we can end up feeling like we're going to pass out, fainting when we get up, and tanking that blood pressure. So any of these symptoms, we want to report them to the physician as soon as we're noticing, keeping a log on that blood pressure to say, hey, we've been trending on some low readings. Let's see if we need to adjust this dose. Medications used to treat urinary incontinence, overactive bladder, even albuterol for COPD. Again, some of the side effects on those medications relate to falls. And then, of course, our diuretics, so our Lasix, our Bumex, when we have to urinate more often because we're getting the fluid off, then we're making quicker trips to the bathroom, which can, unfortunately increase our risk of falls. So we want to keep that in mind, right? Might be time to have a therapist come see you if you're noticing some symptoms related to this, but the primary thing would be discussing with the physician. Fall prevention in the home. So some additional factors to consider. Wearing briefs to avoid rushing to the toilet. If we know there's urinary incontinence, y'all are familiar with this. It is so easy to try to run to the restroom, which absolutely increases our chance of falling. So the briefs, I call them like insurance. If you have them on, if you go a little bit on the way, it's okay. You can take your time and not rush. That includes the phone and the doorbell as well, right? Even if those things ring, that person can wait. We want to take our time to get to the door, get to the phone, get to the toilet. And good lighting at night, another really important one. Y'all can look on Amazon. They have motion sensor lights that you can put in the hallway, in the bathroom. And you could also just increase the number of lights available. So on the bedside, an easy to turn on lamp. So when you're sitting on the edge of the bed, giving yourself time to sit there a moment, cut your light on before making that trip to the bathroom. Every night before going to bed, whether you're a caregiver or an older adult yourself that has fallen, check that pathway before you go to bed every night and make sure there's nothing on the ground between the edge of your toilet and your bed. So even the smallest thing, a shoe, a cat toy, dog toy, that item can of course trip us up when we're drowsy and groggy. Appropriate footwear. I recommend never walking around in regular socks. I'm good with the hospital grip socks. You can also get ones that are just short socks that have grips on the bottom that aren't the actual hospital ones. But those are great, right? Other options are just good shoes. So for bedroom slippers, I prefer ones that have backing and that are non-skid grip on the bottom. I don't prefer the regular type of slippers that don't have a back because when you put them on, your foot could be at an angle, which can, cause us to lose our balance walking. In the photo on the right, y'all have probably already looked at it, but minimizing heel is important. And then just for any pair of tennis shoes, just making sure the fit is good. So they're not too loose, and they're comfortable and they feel like they're giving good stability. For dementia, one issue can be as our memory changes, we can forget to use our assistive device. So an example of a technique to help that would be visual cues. So what I prefer is you can get like neon yellow or pink construction paper on Amazon, Walmart, and on it just write in big Sharpie, black Sharpie, use walker. So you can actually tape that to the inside of the walker wherever you position that next to the couch or a chair. And so when you get up, that individual's more likely to notice and remember to use their device. You can also put tape, so that highlighter color electrical tape at the hardware store, onto the walker handles or the wheelchair handles, just as a visual cue. And we're going to come back to bed and chair alarms. We'll talk about that in a moment as well. I would say the visual signage for dementia works the best for mild to beginning moderate cognitive impairment. When we get to be more severe, those visual cues aren't really going to help. And that's where these alarms are going to be really extra important. Alert pendants or a watch. A lot of companies now, you can choose between a watch or a pendant. Even an Apple Watch has fall detection and you can wear it in the shower. So these are great tools. Again, if anybody lives alone, I always recommend them, right? Because it just takes one time not having your phone in your pocket, and then we don't have a way to call for help if there is a fall. We want to play this video for you all. I did a partnership with News4Jax last year. We went into a patient's home and talked about fall prevention, so we're going to play this video for you all.
News stories all week dedicated to helping senior citizens and the people who care for them. During the last hour of the morning show, we explained where you can find financial assistance for seniors and their caregivers here in our area. Now we're showing you the most common reasons older relatives fall at home. Brooks Rehab walks us through the home of a Jacksonville couple in their 80s. So we're at the Edenfield.
Yes, we are. Come on in.
Chandler Rice is an occupational therapist. She walks us back to the bathroom, which is the most common area where older people fall, and she's already found a problem.
throw rugs that do not have grip on the bottom. So you see how this one, when you put your foot on it, moves.
This should have a skid-proof mat under it. Rice explains 3 other common reasons older people fall in the bathroom.
I would say not having grab bars, not sitting to take a shower, and then not having the non-skid surfaces.
What about getting up, let's say, in the middle of the night? Is that also an issue?
So we always discuss a few things. One, every night before going to bed, make sure the pathway is clear between the edge of the bed and the toilet. Always turning on a light. Never rushing.
She says a handrail next to the bed is very important. And make sure the bed is not too high.
Sometimes the floor is too slick with like the bed being high. And so we'll recommend, it's kind of like a sandpaper material mat that you can put here to prevent sliding when you put your feet down. And then never walking in regular socks.
Beth Edenfield is Rice's patient. She has fallen twice at home.
I pushed the table and the table went further than I thought. And I fell then, and that's when I broke my shoulder.
She and her husband are in their 80s.
A few months ago, I fell in the garage coming home from church.
Richard has a condition that makes his feet numb. He shows us how Rice has taught him to reduce his chances of falling when he steps into his garage to do the laundry. Beth is going to start using a cane to steady herself when she needs it. She has spent nearly 60 years taking care of her husband, and she says she isn't about to stop.
I'm always got, if I get incapacitated, I'm not going to be able to help him like I need to.
With Rice's help, both are focused on staying safe in their home so they can spend as much time as possible with their children, grandchildren, and great-grandchildren.
Have you seen the average?
Yep, love the Edenfields. Let's see. Okay. So now we're going to go into specific equipment, which I really enjoy sharing this. This is what I do every day as a home health occupational therapist. So really all of these items, which during the Q&A we can answer more questions if you have them, but can be purchased on Amazon. What I will say is insurance across the board will pay for a bedside commode. The nice thing about a bedside commode is they really call them 3-in-1s because they can be used as a true bedside toilet, right? Put it next to the bed, use it at night instead of getting up and going to the restroom. It can be used as a shower chair. I will say it does not typically fit inside a tub, so you tend to need a different type of shower chair, which we can go into. And then they can also be used as a toilet riser. So the bucket can come off and it can go over top of the toilet itself and use it that way. So insurance will pay for that. Insurance will also pay for a walker or a wheelchair, but the wheelchair is only every 5 years. And then if insurance just recently paid for a walker, they then will not typically pay for, Medicare will not typically pay for a wheelchair. So it's important to, if you have to prioritize, go ahead and get your wheelchair through Medicare and you can get a walker off of Amazon. In the bathroom specifically, on the far left, I like the toilet risers that actually attach to the back of the toilet. You guys have probably seen toilet frames where they don't attach, they're kind of freestanding. I don't prefer them because if you were to get up just pressing with one hand, you could fall over. So this one is on Amazon. It's $65 if you just look up toilet riser with handles, and you actually can still sit on the actual seat of the toilet. It goes on top of the plastic riser, which is nice. The second photo is a Gorilla Grip bath mat. That brand is the only one I recommend. It's on Amazon for $11. Half the stuff y'all see in stores, it'll say non-skid, but it's not non-skid. It'll move, and we don't want that to happen. The third photo is a tub transfer bench. I get excited about this because I have a lot of patients who tell me, Chandler, I haven't been able to step into the tub in years. It's just not safe. But I don't really have the money to renovate my bathroom. This bench is $51 on Amazon, and you sit down on the edge and swing your legs over without actually having to step in, which is wonderful. And it's universal fit, so we can take the backrest off, switch it to the other side, so it can face whichever way it needs to face towards the faucet. This handheld shower, it's Aqua Dance is the brand on Amazon. It's $17. It has 6 different settings, and one of which allows the water to still be coming, but pauses it coming out of the faucet. So you can just let it hang, and it's not going to spray everywhere and get your floor wet, so you're worried about slipping when you get out. I know we said this in the video, I believe, but I never recommend suction cup grab bars. They're just not trustworthy at the end of the day. So my preference is the metal screw-in bars, and I like the placement of one vertical bar wherever you step in, right? So it's just on that shower wall so that you can hold on when you step over the tub or you step into the walk-in shower. And then one long horizontal grab bar on the inside wall, so that when you're sitting in your shower chair, you stand up, you can hold on to something secure to rinse off, or if you stand to shower and your balance is good enough for that, you can just hold on to that the whole time you're bathing. In the bedroom, I really don't prefer those type of step-ups that are stair-step. The reason is they tip over pretty easily and they're kind of slippery. So I like this wide, you can just look this up on Amazon, it's a wide base bed step-up. That's all I searched to find the left photo. Bed rails handles are great as well, and then that's just a photo of some non-hospital looking grip socks on Amazon. For dementia, if you've had just one occurrence of your loved one trying to exit the home unattended, my recommendation would be it is time to go ahead and get those locks. So you can get them on Amazon. They just go kind of like the top baseboard part of the door, right at the top. And so it's a little bit, it would be easy for y'all to do. It's a little complicated for them. They just, even with mild cognitive impairment, it's kind of hard to open it. So anyways, I would put them at every entrance or exit of the home so that there's no chance of leaving alone when you don't realize. The bed and chair alarm also, the reason that's so important is, again, if that inhibition is lost and that safety awareness isn't there anymore, it's impossible to really have 24/7 eyes on somebody. So in the middle of the night, that little handheld piece you can keep with you in your bedroom. And when they get up, you're going to hear that alarm go off and hopefully come in enough time to help them sit down and not fall. So the Lunderg is a great brand. It has 2-in-1. I think this is $175 for two for the bed and the chair alarm, but you can buy them one or the other. But this brand is very good on Amazon. I wanted to mention about low vision. So in older adults, there's 3 most common eye conditions: glaucoma, diabetic retinopathy, and macular degeneration. All 3 of those can put us at greater risk of falling. One technique is, a lot of our homes, we have patterned rugs, okay? When someone has vision change, it becomes difficult to distinguish an object versus the pattern on the rug, which can cause falls. So it's better to minimize that pattern, which will help someone identify obstacles better. Increasing the number of lights. Now, that doesn't have to be installing above ceiling fixtures. It can just be more lamps around the house. I prefer white LED bulbs. So incandescent, warm light, they just don't illuminate enough. So only white LED bulbs is what I recommend. You can also, for any threshold changes around the house or stairs, like let's say there's very poor contrast, like you step out of your kitchen into maybe a sunken living room and the color of the flooring is similar, put a bright piece of tape there that can cue someone where that step is, whether that be the edge of stairs, anywhere inside the home, great. So that can also reduce falls. As far as equipment used for walking, I highly recommend, if you haven't had it in a while, go ahead and see a physical occupational therapist to discuss which device is the safest. It is really common, especially with like Parkinson's disease, where someone has used a rollator walker, the one with the seat, for a long time. But when that mobility progresses and imbalances worse, that device can really get away from us. So because there's the 4 wheels. Now, it's super advantageous otherwise, right? We can have a portable seat, we can lock those brakes, which is wonderful. But having the actual therapist recommend which device is best for you and your safety is great. Aluminum two-wheeled walkers, those are really good. One trick also is if it's too wide to go into the bathroom, you can actually switch those wheels around to the inside, and you can, even older homes, often you can then go straight in and take it all the way to the toilet or the shower. Wanted to comment as well about the walker trays. That allows someone to have their hands free to always hold on to their device and not juggling, trying to carry a plate, a glass of water, other items around the house.
Okay, thank you, Chandler. So we just spoke about how to be safe within our home, but we know that we are very active, and if you care for your family member or yourselves and you need to go out and about in the public for doctor's appointments or whatever, we need to also know how to stay safe out in public. And some of those same recommendations that Chandler provided would be some of the same things we do out in public. So let's just make sure that we pre-plan those routes, that we check those destinations, and we see what the accessibility is at those locations. We want to make sure that there are flat surfaces, that there are ramps available for folks to walk up and use their rollators or their walkers or the wheelchairs so that they can get into those facilities safely so we can avoid any unexpected hazards. We also want to make sure that, as Chandler mentioned, we have that correct supportive footwear. I know my mother-in-law, when she was out visiting some of her family members, she kept falling, and we couldn't figure out why she kept falling. And when I went to go visit with her, I looked at her shoes, and I said, "Are these the shoes that you're wearing?" And she goes, "Yes." I said, "Well, they're not really fitting your feet well, and they had the open back and things of that nature." So we talked with her about adjusting the footwear so that she would stop falling, and she hasn't had a fall since. So just make sure that we are looking at that closely, because that's very important. That could be one of the main contributors to why our loved ones are falling. And pacing. Sometimes when we're out walking, we may forget that, we need to slow down a little bit. So just to make sure our loved ones are not falling into that fatigue-induced falling. So bringing the rollator with the seat cushion can give them a quick spot to sit and take a break if they need to, if they're becoming a little bit fatigued while they're out and about, taking care of whatever the personal business they need to be taken care of. Okay. So how to stay safe after a fall?
Okay. Thank you, Teresa. And thank you so much for attending this event. We are excited to be here and to share all this to you. So anxiety and the fall cycle. So after a fall, a person is likely to fear falling again. This often means they became less active, which leads to weaker muscles and poorer balance. And of course, increases the risk of further falls. We call this the fall cycle. So first, when you had a fall, all of this becomes a threat to you. You become scared. And then you don't want to get up, you become depressed because of the fear of falling again. And then, of course, it will be less activity. Your muscle become more weak, and you become more disengaged. And decreased muscle and strength and balance, increased risk of falling. So it's like a cycle. So it's very important that we acknowledge and recognize that sometimes we do need help.
Oh, yeah. So we also want to discuss how to stay safe after a fall. It's very common after falling, right? We're in panic mode and we're like, how do I get my loved one up? But it's very important to stop and check them out first and see if there's injury before moving somebody. So, the decision is going to be, are we going to call 911 or are we going to help them get up safely? That's number one before we touch them and do anything. If we suspect severe pain, particularly in head, back, and neck, and we know that they've hit their head, let's call 911. Let's not even attempt to get somebody up, right? Because we don't want to cause further damage if we've got a spinal cord injury or a head injury. And bleeding. Now, I will say, if it's a skin tear and that's reasonable and we can help them up, okay. But I'm talking bleeding, right? Just let's call 911. getting up safely if uninjured. So if we've made that decision, we really don't need to call 911. Let's get them safely into a chair. So the first thing we're going to do is turn slowly on their side. And this photo is going to, show you everything, but get on hands and knees, crawl or scoot towards a sturdy piece of furniture, like a solid chair. If it's against a wall, even better. But, as long as it's a relatively sturdy chair, great. Use your strong leg. So if you know that if your family member has had a stroke and they have left-sided weakness, use the other leg, the right leg, to get up underneath them so that they're getting up on their strong leg. And then ease into a seated position. Watch for changes over the next 24 hours, okay? Like we said, if they've hit their head, certainly if they're on blood thinners, we're going to get a head CT in the ER, okay? Definitely, we don't want to play around with that. But regardless of the fall, we want to monitor the next 24 hours, check for new pain. Is there confusion? Is their weakness even worsening over that next 24? Then we want to call our doctor and discuss with them. If it's super urgent, then we'll go ahead and go to the emergency room.
I just want to add also,
Mm-hmm.
with that, I know the first 24 hours is very crucial because normally that's where the onset or the start where you're feeling the pain. And immediately once you're on the floor, you can feel yourself if you're having pain on your legs, your back, or your head. We also need to kind of keep in mind sometimes it's a delayed reaction. I know Chandler mentioned if you're taking blood thinner like your Coumadin, your Eliquis, your Pradaxa, your heparin, your Lovenox, I'm sure there's other more blood thinners. Aspirin is one of the most common one that we just get over the counter. Keep in mind that you want to monitor your loved one or your family member or yourself. Sometimes it goes up to 3 days and beyond. Could be some adverse effects. So please, talk to your family. These are the things, and so keep asking and evaluating them. Sometimes they don't think that it's related to the fall 2 days ago. So it's very important that we, when we have an injury, we need to share and talk to our loved one, and so we can also notify our physician. That way they can evaluate sooner if there's any emergency.
And also, to your point, I think that's great what you said. Also, if you feel that in any way you're putting your own body at risk, like, you have a bad back or you feel like you're chancing something in your own health to help your family member up, it's always worth just get the EMS guys to come. It's if you injure yourself, then you no longer can help your family member anyway.
And there should not be fear in calling EMS to help. That's what they're there for. So please call. The same advice I gave my mother-in-law. Call them. They will come in and they will assist. Okay.
And also, it's very important that when we're in a panic mode, we suddenly forget our address. And of course, the list of medications, right? So it's very important that we keep that in mind. Like Chandler mentioned and Teresa earlier, being prepared because this could happen anytime, any day, any hour. Have your medication list on your refrigerator, a list of medications, even your address and phone number of the person that you need to contact. That way you are prepared.
I think I see a hand out there, but we do have a moment for question and at the end of the presentation, if you don't mind.
Definitely keep it though.
Yeah.
We want to hear it.
Yes, I see the hand. She's just sitting there like this. So moving forward, communication, especially if we are the children taking care of our parents. We're concerned about them, their health, their safety, their well-being, and not crossing over that parent-child relationship. Okay, so let's talk a little bit about that. So managing those situations, I don't like to use the word behavior because it sounds like a negative thing. So managing those situations we find ourselves in, we start having to have these needed conversations. So Chandler already mentioned very well about restlessness and wandering, so we won't repeat much of that. But the area I want to focus on is resistance to assistance and sundowning. So let's talk about sundowning real quick. One of the things that we can do to try to reduce the incidence of sundowning is, she mentioned those bright white lights. So what happens with the sundowning is as the sun goes down, folks start noticing that change in lighting on the outside at that time of day. So if we can have the lights be bright in our house, then hopefully that will help reduce those incidents of sundowning and those behaviors, those wandering situations that we find ourselves in. Because if it's a dementia-related situation, they could be trying to relive something, and we just need to figure out what that is. But to reduce it, let's keep those lights bright in our homes. Resistance to assistance. Let's talk about that just a little bit. So why is there a struggle to have these conversations with our loved ones when it comes to keeping them safe and making these environmental modifications within their homes, or even insisting that they use an assistive device like a cane or a walker or a wheelchair? It is that feeling and loss of autonomy. Our parents, or even maybe our adult children, if that's, or even ourselves, we love our independence. We love our independent decision making. And now you're telling me that I'm losing that bit of myself. And that may come across as a trigger for resisting the advice that you're trying to provide. They don't want to lose that dignity, that identity. So we need to acknowledging those fall risks can directly challenge their person's self-image of who they see themselves, how they see themselves. So, and being self-reliance, we like being able to depend on ourselves. Perceived patriotism. I, being an adult child of a mom she'll kill me, 76-year-old mother, she lives in another state, but I still have to be mindful when I'm offering up advice. How do I approach that conversation with her so she doesn't shut down or be resistant to the information that I'm trying to provide to her? Because she's still, she's my mom, she's my parent, and she will tell me that whenever we're having a spirited conversation. She will remind me, I'm still your mom, okay? And that fear of the outcome, going back to that independence, going back to their autonomy. Our homes, that is our safe space. That is our comfort zone. That is where we raise our children, where we have the birthday parties and the anniversaries and the family gatherings. I don't want to lose that. So if I admit to having a balance issue, if I admit to not, if I admit to falling, if my mom were to call me today and tell me that she's fallen, I'm in my car and I'm driving over trying to figure out what's going on. She doesn't want to leave her home. Our parents don't want to leave our home. We don't want to leave our home. So that doesn't always have to be the outcome of that conversation. Okay, so we just need to come across and work on some effective ways to communicate those our concerns with our family member without making them feel like we are taking over their control and their bodily autonomy. So we need to validate their feelings. Let's validate that, and rather than arguing with them, change our conversations, shift some of the words that we use when we're having those conversations from, no, you can't do this, go sit down, to let's talk about it. Maybe we can use this walker to help you be safer. So validate those concerns that they're having. Give them single-step directions, especially if cognitive decline is a part of this, is in the mix. So break instructions down so that they're simple and easy to follow. If you notice that your loved one is starting to use fewer words, then you've given them a litany of things to do, an entire list, is going to increase their frustration, because they're not going to be able to follow all those individual steps. Give them a step, let them accomplish it, then give them another step and see if they can accomplish that. Maintain that eye contact, and like I say, gentle touch, okay? We all love that personal connection with the people in our lives. So make that eye contact, be on their level, don't be standing above them while we're trying to have these very sensitive conversations about keeping them safe and maintaining that safety. Use positive language, like I said before, learning how to reframe what we said, frame statements around what to do rather than prohibitions. Let's sit down here instead of don't stand up, okay? So have a plan in your mind of how you see this conversation unfolding, and so that you can keep the temperature in the room down and from escalating into a space you're not trying to go. And again, allow them time to respond. Give about 10 to 15 seconds for your loved ones to process the information. I say to my husband a lot, he'll have these thoughts, what about this, what about that? I said, give me a minute. You've been thinking about this all day. This is the first time I've heard it. So just give me a moment and give your loved ones that moment to process the information so that they can feel like they are being added to the conversation instead of being told what to do and how to manage. Okay, so again, safety and independence, and we're getting close to the end, so we're going to have plenty of time for conversation. So safety and independence can coexist. So if you are a child working with your parents, partner with them. Don't parent. Continue to validate their concerns, validate their conversations, let them know that they're safe. Okay, start with open-ended questions. Ask them for their input and what's happening. Let them know that these assistive devices or anything that we're doing as far as involving a third-party therapist is not there to take their independence away. It's really there to keep them independent longer. You keep them safe longer if we use these tools and these resources that are available to us throughout our city. And keep it ongoing. View safety as an evolving, open conversation rather than a single intervention.
So we wanted to touch on also just our system of care at Brooks. So we have a variety of services, all sorts of divisions, really across the entire spectrum of care that your family member or yourself might go through. So whether it be acute care hospital, whether it be inpatient rehabilitation, like after a hospital stay or an acute care stay, going to inpatient rehab before coming back home, and which is, my setting, which is seeing people at home. You can also have just community referrals for home health. So I really wanted to mention that. It doesn't have to be that you were just recently in the hospital. Your primary care physician or neurologist, they can write a referral to Brooks Home Health. And the way that you know if you qualify for home health is whether it's an exceptionally taxing effort to leave the home, so because of a health condition. So means, maybe require another person to leave the home due to transportation or due to an assistive device like a walker, wheelchair, cane. It's okay if you go out for church, the grocery store, some outings is fine. Doctor's appointments, that doesn't disqualify you from home health. But after that point, once someone is, stable enough at home, we can arrange transportation. At that point, then we can go to outpatient therapy. What we wanted to mention is there are so many locations across Jacksonville for Brooks Outpatient. And there's a lot of specialization. So for example, the Balance Center off Centurion Parkway, excellent for, if we're talking about vertigo, just balance fall prevention program. It's a wonderful location for physical therapy. And then our healthcare plaza, which is off University Boulevard and Beach. So we service, that actually is the clinic that specializes in neurological conditions. So whether it's stroke, Parkinson's, any kind of neurological conditions. And then I wanted to specifically mention those two because it relates to falls. But, if y'all just look up, I think on our booth out there, there's some more information on locations for outpatient clinics. But we've got Dunn Avenue, we've got just a wide array. So by all means, if your loved one is needing some additional education, we can come in home, customize recommendations, as well as our whole spectrum of care. So.
Yeah. So in addition to the resources, Brooks has been serving the community for over 50 years. So we have different resources, and also we have two inpatient hospitals, one at University and Beach Boulevard, also one at Bartram campus. We have two skilled nursing services, which is one in University and one in Bartram. Teresa and I work at the Bartram campus, the Bartram Crossing Nursing Home Rehab Facility. So we're post-acute and short-term and long-term rehab. Again, a lot of our patients are coming from the hospital. It's a short stay, meaning about 20 to 25 days of length of stay, depending on your insurance and, of course, the need. That's where we continue with rehabilitation, and of course we've got physical therapists, occupational therapists, speech therapists, and of course it's a 24-hour nursing services. So once they discharge to us, transition to home, that's when home health continue to follow. Of course, one of the biggest thing that we look at is the safety. So fall prevention is very important.
We also have our assisted living and memory care. Those locations can offer a little bit of respite for those caregivers. If you need that time to just re-energize and refresh, you can also look into those services, if not with us, with other facilities that offer that type of respite services.
All right.
Okay.
We're happy to answer any questions that you all have. We are we're happy to have questions. So y'all, yeah. You definitely begin because you can raise your hand.
Go first.
Mm-hmm. Yeah, that's a great question.
Can you have
So-
her repeat the question, please?
Oh, yes, I can.
Chandler.
So she's asking so kind of multiple things. One, what do you do if you fall and there's nothing around you? And let's say like you're outside and there isn't something to get to pull up on, and if you're alone in general. So that method that had that graphic on it was actually for when you're alone also. So it's the same technique. If you can get to a sturdy piece of furniture, that's the way to do it. So whether there's a caregiver or not. What I will say about outside, so that, or just if you're in somewhere and you cannot crawl, because remember, yeah, first step is we're trying to, in a safe way, crawl if we've determined that we're able to get up without 911. So if that person then cannot crawl to some sort of stable surface, maybe it's the stairs outside leading back into the house to get up in that same manner, going to all fours, that's good if that's possible. I think that it's even more of a reason to have those life alerts. I'm saying life alert, not necessarily that brand, but just a pendant, because you're right. There are going to be instances. What if you're out in the grass in the middle of the yard and you were checking on your garden and there's nothing to pull up on? So that's where that emergency alert would be the answer, because, I mean, you all have probably experienced this too, unfortunately, but there are individuals who are on the floor for days, hours, and so we have to prevent that. The only surefire way is having that fall detection alert pendant, that if we're in a situation where we cannot use something to get up, we have that. Yes, ma'am.
Same
Pink.
question on like
Oh.
total knee joint.
Oh, I'm sorry. Where are you? Oh, okay.
Total knee joint. I can't
Total-
get up
Total
on
knee.
my knees.
Yeah.
So go ahead, tell me how to get up.
Yeah, so total knee. Okay. So total knee, that would be where I would say you're probably more likely to accidentally injure yourself further. So I would want you to call the EMS guys. Yep. I'd want you to call them. And there'll be 5 people, they'll get you up. If you're okay, they're going to put you in a chair. If you can stand up, you don't need to go to the hospital. They can just come and get you up.
Mm-hmm.
Mm-hmm. Do you want me to call on people, or do you want me to call?
Yeah, that's
Okay. Right here. I'm sorry, Pink first. She was first. Yep. Okay. You're Pink. You're Pink.
Nice pink.
Thank you. Wonderful.
Made sure that I had the right ramp, the toilet, made sure she took off the glass
Sliders.
in the shower. So you have all this help for you that you don't have to pay for if they're a vet and they meet the requirements. So please check that out first. It'll save you a lot of money and they offer you so many different services.
I'm so glad that you brought that up. To your point, with insurance, I wanted to mention, yes, VA, anything, TRICARE, you're good. So if you can get that service, wonderful. Another is, I wanted to mention, if anyone in here has United Healthcare, call the number on your U card and find out if you have a monthly balance. I had a gentleman the other week, he had no idea he had $226 a month allotted towards different durable medical equipment he could use in the home. So, of course, then if we have that, we can get a shower chair, even though, Medicare won't as much. But anyway, call your insurance.
Right, and the last
Yeah.
thing, it's never too late for them to get the VA Health ID card. It determines on what the situation is. You can go to North Jefferson Street, you can go to North Clinic. Those are the two best places to go. Additionally, everyone in the VA health system has a social worker. So when I need new mobile equipment, I go to my primary care team and let them know. I also let my social worker know when issues have changed and I need additional equipment. Right, and then there's a whole caregiving program with the VA, but that's based on what percentage of disability they're receiving.
And if you can't get VA, we have home health social workers as well at Brooks.
Absolutely.
We
have someone up front as well.
For that shower head that you showed,
Yes.
JEA will come out and give it to you. You go down there when they have JEA days.
Okay.
And they will install it, and it clips, and you can take it down. So find out when JEA have their JEA days, and send the seniors right down there, and they bring the light bulbs out, the LED,
Yep.
and all that stuff.
That's
So
wonderful. I didn't know that.
Yeah, and they have one that go in the kitchen sink that kind of make the water go out a little differently, and you can flip it up. Yeah, I don't know what you call it, but they install it for you, and it's very nice.
Good
Excellent.
information.
Thank you for sharing.
Okay.
My name is Zeb with ZKL Financial, and I first would like to say thank you for your service, Gladys. I am also a veteran. I have a question regarding, for those who don't have showers and we have seniors in our home, you have bathtubs. How do you get them in and out without them hurting themselves?
Yeah, so the bathtub would be that tub transfer bench. So if I had it in a photo, but if you just type that in on Amazon, so that's that bench that you don't have to actually step over the side of the tub anymore. You just sit down on it and swing your legs in and you're in. And then scoot, swing your legs up, stand up, you're out. So you never have to step over anymore. For $51 instead of thousands to renovate your shower. Yes, ma'am.
Well, I had a suggestion for something to add to your fall prevention. Another very common source of falls inside is pets.
Absolutely.
And
That's a
dogs.
wonderful thing to say.
Yes.
Absolutely.
My cat likes to bump me whenever he sees me. He wants to bump into me on affection. But I have another solution to prevent falls at night. I do have to get up and use the bathroom. Luckily, the bathroom is maybe 3 yards from my bed. But I have these things called Zebos. It's a bug catcher. And it's very annoying. It has this purple light. And I have one in the kitchen, one in the living room, and one in the bathroom. And the one in the bathroom shines into the bedroom. I can't prevent it. It has this glow. But on the positive side, I never have darkness at night if I have to get up and use the bathroom. I follow that purple light, and I'm safe. And I have grab bars too.
And you don't have bugs. Because you're using bugs. Because you're using bug zappers.
That's debatable. I have a cat.
Oh, yeah.
Okay. I have bugs. Thank you.
Thank you.
I had a question about why, when you're getting up out of bed at night and going into the bathroom, you have to put shoes on. I think walking barefoot in your own home gives you a lot more sensitivity than putting on any kind of shoes or slippers. Just walk barefoot.
I'm very okay with barefoot. It's really just regular socks and then like slippers without backs and anything with a heel. Those are the things to avoid. Barefoot is good.
I recently moved into a home and I got Lowe's Home Improvement to come out. They have a free service where they will come and assess your home for safety and recommend to you what you need and what the prices would be, and you're not obligated to buy anything from them.
Cool.
But when I had them out, I had 2 grab bars installed into my ceramic tiles. It was rather expensive, $600, but it's well worth it.
Right. Yes, ma'am. Thank you.
Just a quick question. If you're a caregiver and you have to go out of town or out of the house for overnight, is there a good source that you can call to get someone to come in for a day or two?
So, did you want to answer that? You want me to answer it? Go ahead. Okay.
Okay.
So I know this is kind of a long-winded answer, but I think it's important. So Elder Source has a booth out there. The thing with Elder Source, which y'all go visit them if you have any questions about this out there, but it typically can take time to get on a list with them. So that wouldn't really be respite care, but it would be important to get set up with them so that, if you need consistent caregiving. Respite care, what I would say is I would probably talk to any of the agencies that you may have seen, like Brooks, for example. We have Brooks Custom Care, which is our sort of private pay sector of having like a CNA come. Now, sometimes they have an allotment of hours per week, but they always encourage us to not really say that. Call the number. You can look it up, Brooks Custom Care, and give them a call and ask about respite care services. Another example is, though, you can arrange to have a facility take your family member for a certain amount of time, if it's like a week or a couple weeks. Do y'all have more information on that? If not, we can refer to
we do have on our skilled nursing respite care and also the assisted living. It depends on the need of your loved one or your family member. So we do have the skilled nursing and the assisted living.
I'm a caregiver, and I know what you're talking about. I went to Japan last year, and I had to use the rest of the service. But like I say, my father was VA. So they came to his location and kept him, but he don't like what they did. They kept him for 24 hours. He didn't like that part, but I went to Japan. So you got to look for the source and everything else. 'Cause I did a lot of research before I went to VA for it, because I didn't like the partner that we were going to use for VA. So I went compare. And like you said, you go to nursing home, all of that, and you see the different costs for that.
Absolutely.
Yeah, just make sure whatever works for you and your family, as far as the, I like to say the least restrictive environment for you, that you can feel like your family is also being cared for, whether it's in a facility or you have someone come into your home.
This is another comment. I learned being a caregiver. My mom was hearing impaired, and I happened to volunteer for Red Cross when they do their annual sound the alarm. The Red Cross would come out and replace smoke detectors free, up to 5. The fire department also. But what they told me was that for hearing impaired, they have bed shakers.
Oh, interesting. Wow.
So please, if you in that situation, give the Red Cross a call.
Yes. That's good. Good. I'm glad. Yeah, avoiding the ladder is good.
Hi, I'm a caregiver. My parents live with me, my husband and me, for the last 3 years. And my question is what your thoughts are on that. We have going into the backyard from outside. There's I caught my mom sort of gripping the wall, trying to get down the 3 steps. But I've seen those like round bars, but they're really expensive. And I didn't know if you had something that you recommended that goes into brick. Really, it's a real, without paying $600, I think is what the one I saw online was.
Yeah, I would say that cost may be kind of typical. If anyone else has an answer different than mine in this room, more than welcome to share it. But yeah, I would say any kind of handyman or whatever, they're probably going to charge more from needing to install the brick. Sometimes they can do like an iron sort of railing that installs instead into below, like if it's at concrete on the bottom. Yeah, so it could be like just only secured to the base, to the actual concrete floor instead of into the brick. I'm not sure which is least expensive, but yes, as long as it's truly drilled into the cement, that's great, or if it's drilled into the house. The only caveat of the metal one, I know what you're talking about, it just needs to truly be long enough to capture the entire stair steps. So a different type of rail might be better. They're short, okay, yeah. Oh yeah, Amazon. It's always the installation. The installation is the expensive piece, but Amazon does sell them. She's correct. Yeah, correct. Anyone else have any questions? No. If not, thank y'all so much. We're so happy that y'all came. And if you need our services, we're here.
And our exhibitors are still out in the hallway. If you haven't had a chance to visit with them, please go on out and say hello. Thank you all for coming today, and thank you, ladies, for your presentation.